I'm Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at phlebotomy, or the removal of blood when testosterone levels are too high. Here are 5 simple points. Now, once in a while, red blood cell count in people on testosterone can become too high, necessitating a phlebotomy, which means the removal of some of the patient's blood. Here are 5 simple points. Number 1, testosterone increases the production of blood cells. One mechanism for this is the stimulation of the production of a hormone, erythropoietin, from the kidneys. Erythropoietin is a hormone that works on bone marrow to stimulate more red cell production. So here's an example of this. Point number 2, when blood is spun in a centrifuge, the heavy red blood cells will settle down to the bottom of the tube. Above that is a small layer of white cells and platelets, sometimes called the buffy coat. And then above that is a layer of serum or plasma. The hematocrit is the percentage of the blood that is red cells. So in the drawing that I've shown here, the hematocrit is about 41%, meaning that 41% of the blood consists of red cells. Then you can see that there are about 4% of white cells, and the plasma or serum is about 55%. This is a normal value. Another marker that increases in people on testosterone is hemoglobin. Hemoglobin is the molecule that carries iron in the red blood cells. With more red cells, there is more hemoglobin. So the hemoglobin measure is typically higher in someone on testosterone. Point number 3, here are the normal ranges. So if we see the group at the left, and then we see the hematocrit and the hemoglobin at the right. In cis women, the hematocrit average ranges from 36 to 46%, hemoglobin 12 to 15.5%. In cis males, we have a hematocrit that's usually 41 to 53%. In trans men, we can see the hematocrit can go from 40 to 54%, which is actually too high. And we can see the hemoglobin going from 3 to 18, where the 18 is a little bit too high. Point number 4, if the hematocrit, abbreviated HCT, and or the hemoglobin, HB, are too high, there is an increased risk of stroke or cerebrovascular accident, MI or heart attack, and then of course venous thromboembolism or VTE, or a blood clot within the system. Point number 5, the hematocrit and hemoglobin can be lowered by decreasing the dose of testosterone, by drinking more fluids to increase the plasma or serum portion of the blood, and phlebotomy, or also called therapeutic phlebotomy. This is the planned removal of about 500 mils, 500 cc's of whole blood from a patient. That would be about a unit of whole blood. This can be done regularly in some patients, say every 2 to 6 months. It can also be achieved by blood donation. So that's it. 5 simple points on phlebotomy when testosterone is too high. For more simple and not so simple information, subscribe to my channel, Transgender Made Simple. Thanks for watching, and I'll see you in the next video.